So why are people worried about measles?
It's really contagious. It spreads quickly across nurseries, through families, and it makes children very, very unwell. And I think another big reason is people just haven't heard of it. I mean, for 30, 40 years, because of vaccinations, we haven't had to deal with measles. And suddenly people are coming across the infection because there's been worries about vaccination, and sadly the virus has really spread through communities.
What are some of the complications that measles can cause?
Upper respiratory tract infection, so cough, cold, can give you a rash. That's pretty common. But the reason why you go to hospital is because the virus can really get into your lungs and cause a pneumonia. And that can be really quite significantly bad for the child. They might need to have oxygen. They very sadly might need to go to intensive care and have a machine to help them breathe. And the other big complication is when measles affects the brain. So it can cause meningitis or encephalitis, which are different parts of the brain that become swollen due to the virus affecting it. And that can be catastrophic and have long-lasting problems for the child's development. And sadly, it can be fatal. Occasionally, we do see children dying from measles, which is devastating.
So how can parents tell if their child has measles?
Well, if they come into contact with someone who's got measles and they're unimmunized, then they're at very high risk. And measles itself can cause a cough, a cold, runny nose, and a few days later, after those symptoms, you can still have a fever, but then a rash can develop. And the rash is often quite sandpapery, it's quite tough to touch. On black and brown skin, it can be quite difficult to see what the rash looks like, but it feels quite different. It feels much rougher to when you touch it. And on occasion, you can get some white spots in your mouth, and they last for about a day or two, and then they actually go away themselves. So it's all of those things in combination with coming into contact with someone who's got measles infection, if you're unimmunized, which should make you think that you've actually got measles infection yourself. So what should you do if you think you or your child has got measles?
So it's really important to not attend your GP practice or A&E in person, but if you can phone your GP or NHS 111, stay at home and they'll be able to advise what to do next. So who's at highest risk if they catch measles?
So if you're unimmunized, you're at high risk of catching measles. So babies who can't get the vaccine because they're too young, if you're immunosuppressed, so if you can't have a live vaccine, which MMR is, or MMRV, then you're at high risk, and pregnant women are at high risk. So it's really important, if you're eligible, if you're able to get the vaccine, then get vaccinated. And if you can't get the vaccine because you're too young or because your immune system doesn't work, then make sure that everyone around you is vaccinated so you're protected. So which vaccines protect against measles?
So for most people, they would have received their MMR vaccine, which protects against measles, mumps and rubella. For children born after January 2025, they may have been offered their MMRV vaccine, which protects against measles, mumps, rubella and varicella, also known as chickenpox. They're both as effective to protect against measles, and the MMRV has been used in other countries for years, but it's just new to the UK.
So what should people do if they're not sure what vaccines they've had?
So you'll need 2 doses of the MMR or MMRV vaccine to ensure long-lasting protection. If you aren't sure, you can check your Red Book or your child's Red Book or contact your GP if you're unsure, and they will let you know what you need and if you need to have a catch-up dose.
So one thing I'd like parents to know about measles is that it's a really, really serious infection. It can make your child very unwell. They might need to go into hospital. And sadly, you could still die from the infection. There are no treatments against measles, and the best way of protecting your child, and really the only way of protecting your child, is by getting vaccinated and encouraging all your friends and family around you to make sure they've got full vaccination status.
It's never too late to be vaccinated. If you're unsure or don't think you've received your vaccines, you can always just contact your GP and they'd be able to help you if you need any doses. And if you're not sure or have questions about the vaccination and the MMR vaccine, please do speak to your GP or practice nurse and they'd be more than happy to help.